So now the panel. So my question to you, Dorica, is what would you like to see happening in social policies in the next, let's say, 5 to 10 years from now to address the challenges of people living with rare diseases?
We are struggling to have a cure. All the patients would like to have a cure, but just a few of the rare diseases have cure. So in the meantime, we have to see what we can achieve and how we can mobilize to use the resources we have. So our vision to address social challenges of people living with rare disease is that different stakeholders or actors in the field of rare disease will coordinate between health, social, and other necessary authorities in order to be able to provide holistic and multidisciplinary care for patients living with rare disease and their families all along their life pathway. I envision that in 5 or 10 years, there will be improvements on the training side too, and there will be more trainings for professionals involved in diagnosis and management of the rare disease, but also available trainings for patients and for families in order to learn how to cope with the disease. It became more urgent to address the social challenges faced by patients with rare disease because people live longer because of the progress realized by the science and the medical care. Also, families have to face challenges for longer years, leading to an increased need of social support and benefits. So social mechanisms of evaluation need to be adjusted to recognize and integrate rare disease patients into existing social services, while recognizing their specificities and providing quality services in response to their needs. For instance, in order to address the specific evaluation of disability in rare disease patients, it is important to improve the disability evaluation procedures, to consider other factors than apart from the functional character of the disorder, such as chronic character, degenerative or acute process of and behavioral aspects. For this reason, the link created by the EUSER joint action that you mentioned, our work package on specialized social services and the Orphanet disability projects represent an important step forward for this, to develop information about disabilities and loss of functionalities associated with rare diseases, and to index the functional consequences of rare diseases with the International Classification of Functioning Disability and Health. It is very important that the National Plan for Rare Disease have specialized social services included in them, and there are concrete actions for the next years. But in order to change this into reality, we need that these actions to be funded in the National Plan for Rare Diseases. And this can be a framework and a part for the solution to speed up these procedures. Of course, we hope to be funded, but until then, we also have hopes that with the accreditation of the Center of Expertise in all the member states, they will be connected with the specialized social services, and there will be multidisciplinary approach. The Center of Expertise will bring together or coordinate with the specialized healthcare sectors multidisciplinary competencies, including paramedical skills and social services, in order to serve the specific medical rehabilitation and palliative needs of rare diseases patients, as it is mentioned in the EUSER recommendations for quality criteria in Center of Expertise. Organizing healthcare pathways for patients suffering from rare diseases through the establishment of cooperation with relevant experts and exchange of professionals and expertise within the country or from abroad when necessary is another way of making services more available for patients and more efficient for healthcare system. Also, I hope that in the future there will be a more active partnership or network among patients, families, and healthcare professionals because it is needed in providing care. The contribution of each member should be valued. Skills and expertise should be combined with deliver integrated care, and the specialized social services will be patient-oriented, hopefully, and adapted to each individual's needs and potential. In addition, specialized social services will be delivered to agreed principles and standards and by competent and skilled staff who are appropriately supervised and accredited by relevant professional bodies. For this, we hope that the guiding principles for specialized social services and for the training of the social services providers already compiled by the EUSUR joint action can be applied in all the member states.
Thank you. That's quite an agenda to address these challenges, but I think it's very clear, and it goes clearly with some of the key messages from Avril.
If I may just end,
please.
My vision is like the slogan of this Rare Disease Day campaign: we have to join together for better care.
Yeah.
So this is my vision.
And about joining, it's all about connecting also.
Yes.
And now I'd like to turn to Terje and Denis, how the new information technology can help us to connect more and where to go in the next 5 to 10 years. So first, we have the privilege to have for the first time with us Terje Peetso, who is Policy Officer for Health and Wellbeing at the DG Connect, which is a DG which is probably less known to most of you. It's not DG Health, it's not DG Enterprise, it's not DG Research, it's DG Connect. And the question to you is, what are the priorities of the European Commission strategy for telemedicine and e-health? So basically, what are you doing to help us go in the right direction?
Thank you. Thank you for the question. And first of all, actually, I would like to thank you for inviting us to this conference. And I have been always considered to belong to this group of policymakers, but I think that actually you are the policymakers. You are the ones who make this policy. So thank you very much for this opportunity to come here, to listen and learn from what you are doing and what are the challenges in front of you. I have 5 minutes to very quickly present you the e-health action plan, which is putting together all the work that the Commission is doing in this area. That, yes, I am from DG Connect, which stands for Words, Communications, Networks, Content and Technology. That's where the Connect comes from. But the good thing is that in that DG we have a unit called Health and Wellbeing, and we have also some doctors in that unit with the medical background. I am one of them. So I believe that we will, by being responsible for the implementation of this action plan, we can bring in this new dimension of support to you involving information and communication technologies in this field. I also believe that this E will soon disappear from the health, as we don't talk about e-banking anymore, because everybody considers it's absolutely normal that we use these things. So the tools that are now called as e-health, as it's something abstract, as we would have e-patients and e-disease, will disappear. So we have 4 areas that the e-health action plan is addressing. And as I said, it is not only what we are doing in DG Connect, but also what our colleagues do in DG Health and Consumers, what the colleagues do in DG Research and Innovation, what the colleagues do in DG Employment. Wherever it is the area of competence, we have tried to bring it all together. And on top of it, it is all what is happening in the member states as well. So, first area, and the biggest one actually, is the interoperability. So if you want to say that get connected, then you have to get connected somehow. And you need for that a technical solution first of all, which means we need the standards, we need an understanding how these things work together, so that if you want to connect simple 2 technical devices together, that actually they will work, and that if you connect 2 healthcare systems to each other, they also are technically interoperable. Then, when it comes to the medical things, it's very important that we understand what is in this system, so that we have agreed on semantics. we have not only the issue of different official languages in the EU, we also have a habit to use medical terminology differently. So the semantic questions is another important area where the interoperability chapter in our eHealth action plan is focusing. And these are also two very important items that the eHealth network, which is established under the Cross-Border Healthcare Directive, is looking at by establishing this communication across the borders on sharing information on health. Then that is the fourth item under the interoperability. It's the legal questions, because that is not only the question of whether it is technically possible and we can understand, but whether it also has all the protection about the data, for example. That we understand how the access to this information is provided and how you are identified as a patient or as a doctor or as a pharmacist or a consultant in another member state in case it is about an access to information, and using it for the best purposes, either for treatment, diagnosis or research. In that part, when we talk about legal questions, is also mentioned the green paper that we are currently working on, and that is about the mobile health, because that is also a new developing area where perhaps Europe is not the worst, but in terms of using applications in mobile phones. But certainly when it comes to the healthcare, then healthcare system as such is really lagging behind other sectors in using all the possibilities that mobile health can offer. And for that, and in particular when it comes to the legal clarity around this, which health app is a medical app, which is the Wellbeing app, and how to make a difference between these two is something that we aim at looking at. And the green paper, as the name says, is for public consultation. So your input, once it's out, and it probably will happen in the beginning of April, your input, your comments are very welcome. And the fourth item under this interoperability issue is an organization, because sometimes in order to implement the electronic approach to something that always has been in classical paper format, for example, it needs an organizational change. But also, when you look into the information that the eHealth helps you to collect, you can see which changes in the organization are needed. There was a very nice study done in the Warwick University, for example, Warwick University Hospital, when they looked how the patient moves in the hospital. And that just putting it graphically on the paper indicated that the patient is doing, instead of 2-3 moves in the hospital as it would be expected, will do around 20 moves, which most of them are unnecessary. So by analyzing this information about how the healthcare system can be organized using eHealth information is another very important item that we could take maximum benefit out of. The second big part of our action plan is research and innovation. There is quite a big part of finance allocated for the use of information communication technologies in health, and that in many areas. It is about looking into the research, trying to create the technology or models that would help the treatment or diagnosis or monitoring, but it is also about deployment. It is about trying the methodology that is already existing or the tool that is already created in another research project perhaps, that whether it would work in all member states and whether it would contribute to this cross-border healthcare. So this project, which earlier were funded from the Competitiveness and Innovation Program, are also now under the same research program called Horizon 2020. And we have just now, there is a call out where the focus of this research project that we expect the proposals on is about the self-management and the patient own responsibility on how to help them managing their own disease using the information and communication technologies. there are two more things I think that I have run out already from my time and also from Denis' time, but I would just like to mention the third one, which is about the wider uptake and sharing information. Because if in one hand we are lacking the tools or solutions that could help, then in another hand we also are facing an issue that we have these things available, but nobody's using them. Not nobody, that's not correct, but they are not widely used as they could. Why? Sometimes it is the question of money. And under that point, for example, we call our attention to the funding possibilities. One is the Connecting Europe facility, which will address the interoperability issues across the borders. And then there is also mentioned the structural funds that the member states can use for developing their own services in their member states. And that is really highlighted, that the structural funds money for healthcare is worth using, not only building the hospital, but actually connecting the existing hospitals. Then about the digital skills, do we all actually are able to use all the electronic tools that are available? Do the healthcare professionals are able to use the electronic health record? And that is also about the digital health literacy. What was mentioned, that people are looking for information on internet, and Eurostat showed that in 2013 more than 50% of people have actually looked for information on health. And a bit less than 50 was among the general population. Above 50 was those who use internet anyway. So people are looking for this information, but do they understand this information? So the question of health literacy and digital health literacy, the issue of trustworthy sources, that people know where to go for this information and how they could communicate in a way that, as it was said, they don't get scared about information, what they are looking for. At least that I can say about my nephew, who is looking for information when her child gets sick. And then first thing what she gets, actually she gets scared. And then, of course, she needs to see a doctor, although the issue itself is not so dramatic as it appears in the first page on internet. The fourth part, and that I will really be short, is about international cooperation, because also we want to share what we have with WHO, with other countries outside Europe, and learn from them, because I would say that nowadays, as science, as so is the health is universal. It is not local, it is not regional, it is not your own, it is global.
Thank you. Denis Costello is the web communication director of EURORDIS, but also the one who is leading the RareConnect platform, which many of you know, and a lot of it, I have to say, is his vision and drive in developing it. So my question to you, Denis, is how do you see these innovative information technologies having an impact on the empowerment of patients in the next 5-10 years?
Well, I think patient empowerment is at the heart of the entire thing, to the extent that what we're talking about here really is changing a dynamic, and to the extent to which the technology can facilitate that change of dynamic. And when we look at the dynamic and try and kind of quantify that, I really enjoy and really admire the principles outlined by the eHealth Task Force when they talk about their vision of they call them the levers for change. For changing the dynamic by which healthcare can be delivered in the context of technology. They talk about things like my data, my decisions. So respecting obviously the need for privacy and protection, but really finding a way in which the patients themselves can use the data in partnership with the researchers and health professionals, and not be in the paralysis that we currently seem to find ourselves in. The second pillar that they talk about is really talking about liberate the data. So they say that open data publication really has to be mandatory for specifically for public health institutions. Really liberate the data, because data is like oil. In the ground, it's useless, but once you bring it out and refine it, it really can have some real distinct value. They talk about connect up everything, and that's what we're talking about with the mobile health apps and all of that. Really find ways to connect the data in meaningful ways so that we can really empower the patients. They talk about things like, obviously inclusion, make sure that everybody's included. And the last point is revolutionize health, meaning not just in a kind of a hippie, cheap way of doing it, really a bottom-up approach, because in rare diseases we have noted that the grassroots, the patients, the bottom up have really been the catalysts for change. So if we start looking at technology and we start looking at the ways in which patients have empowered and do empower themselves through the use of the technology that is available to them, there are ways in which we can go there. So that's the kind of the blue sky thinking, I think, where we're going. We've a long way to go before we get there, because there are quite a number of barriers ahead of us. Obviously there's some great pilots and some great initiatives from the point of view of the Commission, but if we look at the lack of understanding that you mentioned, both from the point of view of patients and healthcare professionals, it's interesting to note that the European Patient Forum's Chain of Trust study last year found that only 16% of patients actually knew what e-health was. But once it was explained to them, 60% of patients would be willing to use it. And it's a similar metric for healthcare professionals. The legal certainty thing is huge when we start looking at data protection and so on. But in that area, I really think that rare disease patients, and this I really would like this to be a takeaway message, rare disease patients, I think, in the current context, can be an interesting case study to create the kind of momentum and value, I think, that you need to show even the member states and so on that the technology can actually work and will work, because rare disease patients, I think, are more motivated. They have been called the power users of the internet, because they have perhaps a lower threshold when it comes to privacy, because they know that the gain can be so great if the tools are put in place in the right way. And I think the framework is there for that, in the way that the Cross-Border Health Directive recognises the specificities of rare diseases, but we now need to capitalise on that in the use of the technology as it's embedded there. You mentioned interoperability, without which really, if we don't have interoperability, we're paralysed and we can't move forward. And then there are the other two challenges that I see are the organisational challenges. If we put in place telehealth or telemedicine, we're going to need new roles. We're going to need telemedicine assistants, for example. So the systems need to change and adapt to that. And lastly, let's not overlook the fact that even though we live in the 21st century, there's quite a large proportion of Europe that is not fully connected. So we need to take that into account and make sure that the tools we put in place respect the equality that that patients have a right to.
Thank you. You both alluded to that, but if I can ask you again a really short answer, is that one is how all that is going to support new generation of knowledge, so the link with the research part, but also how DigiConnect, which is working closely with DG Research, could DigiConnect also work closely with DG Sanco, particularly when it comes to the European reference networks, where all these new technology are going to be so important, and probably in terms of strategic thinking and funding, this is a way to go. We want to start. Maybe you want to start on this one between.
Well, I think that we work very close with DG Sanco, and because there is a lot of these things that I mentioned, which apply universally to all healthcare systems. They also apply for the rare diseases case when we talk about these reference networks, for example. The question of interoperability, the question of identifying an access, data protection issues, they are universal. If we find a solution, how we identify the patient in another member state or a healthcare professional in another member state who would have an access to the database, which is in another member state, that would be a solution for all types of diseases and finding the best access to information. And I fully agree that the information doesn't only make sense when you collect it. The tools of collecting what should we pay attention, but it is in particularly important when it comes to the analysis of it, so that it is systematic and this is accessible and this meets the requirements of data protection. That is crucial for all databases that we are talking about, and in that sense we have a good cooperation with colleagues in DG Sanco to apply the same approach.
And Denis, do you see these communities of patients online and all these connection, whatever the tools used between patients, as a way to generate new knowledge, particularly in the field of rare diseases?
It's clear that it's already happening. I suppose what's not happening is, in a sense, the framework for extracting some of the knowledge that's being developed. So I think we need to maybe start moving in that direction. But it's clear that the patients now have technology in their hands and will have ever more technology in their hands for them to be able to do that. And I mean, when we look at projects even like RareConnect, which had its meeting in Heidelberg this week, I think there are ways in which, and it's happening in registers as well, by which patients are collaborating with the healthcare professionals to generate that kind of knowledge using the tools that are existent to them. So I do see that path continuing, but as I say, I think we need to work harder to put in place the infrastructural tools to extract the knowledge from the patient community, because it's clear, as we know ourselves, that the patient community has an immense amount of
Right, but as you highlighted, my data, my decision, so patients consent to this data, but also they report data, they contribute to the analysis of that, but they need that partnership also with all the academic team for the infrastructure, but also for the extraction of data to generate the new knowledge, right? Okay. Thank you very much for these comments. To conclude this panel, I'd like to ask Dorica and Avril, what's, in a more broader sense now, what needs to be done to empower rare disease patients to be more autonomous and more equal players in shaping policy?
I think it is essential to train them, to know more about how to advocate for their disease, for their colleagues, and for the patients that they care. And we need to do these trainings available in different formats, both online or face-to-face, because not everything works for everybody. And the future of the empowerment is, I think, the essential thing is the training of patients in lobby and advocacy, in how to know the disease better, and to know how the orphan drugs are produced, and to know about how to cooperate with the other stakeholders, to communicate with media and other instruments, how to use all these instruments and tools to create a better environment for the patients.
I'd have to really agree exactly with what Dorica is saying. I think that we have a great opportunity in this era of information technology. If the structures are correct, as Denis was saying, if there are proper structures that we can trust, to allow people to express their own opinions and learn from others. I think that's very important. I think what's important for patients who are representing other patients is they do what we call at home, they have to leave their jersey at the door, You have your particular condition and there's a very specific need around that area, but it's very important to understand the wider issues that may not be specific to you, but are very important to other groups. So again, education is very important, and I think that point is also important within the medical profession and other such groups.
Thank you very much. Now we can open for a few questions, because we had one question here, but I think it has been quite addressed somehow in the panel, which is more directed to Terje, about how would it be possible to use really the structural funds for networking activities in the European Reference Network. You mentioned structural funds in your intervention at the end, and we had last week, in fact, in Luxembourg, an in-depth presentation. And it's great because we heard that health now is part of the priorities for structural funds, and not only health, but rare diseases, thanks to the work of the Commission, is specifically mentioned there. But how can we pass the right message to the member states and to the patient advocates and actors locally on how to activate these structural funds for information technology at national level? Do you have any advice to give on that?
Well, I think that requires what Dorica said, that needs advocacy skills. you really need to convince the right people, because the operational plans about the use of structural funds are written at the member state level. And yes, we have made our suggestions in a general way. European semester has put the health in particular when it comes to some member states, and when we have given the suggestions, but the member states are the ones who make their plans. So it is the question of advocacy and convincing, the highlighting the importance of the need. And then it depends also on the selection of, I would say, that putting the priorities in place. So that's all what we can do from our side, and that is for you to find the right people.
In fact, it's a question from Jose Drabwell. Where are you sitting, Jose? Yeah, Jose, you're here. Hello, Jose. From IPOPI, the Immunodeficiency Network. Jose is from the UK. The question is, how do you intend, in fact, to police the quality and the correct information on website and on all online information? How is that possible? And is the Commission working on some sort of accreditation or something like that? We have the Health on the Net label, but that's questionable. So I don't know, Denis or...
I think in the world that we live in now, it's almost impossible to police the internet to that extent. I mean, if we're talking about quality information, what we can do, I think, is create beacons and resource them sufficiently enough that they become recognized to the extent that they are the reference places to go for information. And by that way, we can, to an extent, muscle out the misinformation that exists out there. That, combined with, I think, best practices, accreditations and guidelines to which other, perhaps less resourced entities can abide by, thereby creating a network of best practice. But, I mean, the internet has shown us that you can find, it's great on the one hand, but it's also very dangerous on the other hand. But as we have navigated and have more than 10 years of experience in it now, I think we have seen these reference portals emerge, exist, thrive. And while misinformation will always kind of continue to exist, I mean, if within EURORDIS, and we continue to do this, we work with our network to build their capacities to provide the best quality information for their stakeholders, I think over time, this is the road which we see to have the most potential and to work.
I would say that most important approach here is that the website is created by professionals and is communicated widely so that people know where to search for this information, that they don't only Google the symptom, but they will go to the website. It's like everybody knows that 112 is the telephone number that you have to call. Then they know that that's the address of the website where you can find the trustworthy information. Because otherwise it is very difficult. It's, of course, when it comes to the structure of the website, that you have to use the right keywords so that if you Google it and this website comes out, these are technical things that the knowledgeable people, of course, are aware of and can help you with this.
Thank you. Thank you very much. And I propose that this is the last comment. We have to stop in order to move to the next panel. Thank you very much to our three panelists and to Avril. Thank you, Dorica, Denis, and Terje.